Hey, I'm Liamith,
My name is Jay, and welcome back to the Medical Frontier podcast.
where we talk about today's inventions, which are tomorrow's standard of care.
In this episode, we wanted to talk about telemedicine and how it's revolutionizing the way people can receive care, even if they live in rural areas and aren't in the closest spots to receive actual face-to-face, hands-on care.
Right. So, when we're talking about telemedicine, this is a very interesting topic, I want to say, because it's very controversial. It is something that has been discussed in healthcare within the past decade or so. It's really, really been revolutionary. But I think that this topic has been more controversial than many things in the healthcare field. I think this is the verge or the beginning of a whole migration into technology and AI. I think this is the very first step which really happened. And I mean, it's obviously been going around for a few years now. It's not something completely new and revolutionary, but there are some nuances to it that we wanted to discuss that we hadn't covered on the channel yet thus far. So, heading right into it, I wanted to bring up some testimonials just to give you guys a brief overview about some of the cons and the benefits. The benefits is the first part I want to bring up about telemedicine and what this really brings for doctors and for patients and kind of what it alleviates from that in-person treatment. So, from Dr. Ingle Owens Schnars, I hope I'm saying that right. She's a daytime hospitalist, and she said that telemedicine has improved her work-life balance, and she feels comfortable leaving her patients in the care of telemedicine doctors. So, that's the good side of it, right? Now, I'm going to tell you about a physician who didn't like it so much. So, this is an anonymous physician in Florida. And the physician says that telehealth or telemedicine has shown her the limits and downsides of telehealth, such as missing opportunities to talk to patients about things like mammograms and pap smears. She also says that she and most patients prefer in-person visits because they are more personal, thorough, and better for patients' health. So, going off here, Jai, what are your first thoughts? Or Jay, sorry, what are your first thoughts on that?
Yeah, so I'm just thinking mainly like how they would actually assess like what the patient. I mean, obviously, like if they're old and not old, but if they're adults, they can easily communicate what they're dealing with, what's going on. But like when you go to like a normal doctor's visit, they take your vitals, they take your blood pressure, they take your height, they take your weight, they take like like they check if you have strep and things like that. How would they go about doing that in a telemedicine way? Is the
Right.
first thing I'm thinking about.
Yeah, and something that I just realized when I was talking about this and listening to that patient is that or that physician experience is that some doctors require a more personal level, right? And it's like you can't really discuss certain things over the phone, or maybe people aren't comfortable doing that.
Yeah.
I think, looking at the statistics side of it to see how much it's really impacted and what are the satisfaction rates, right? So that's what matters.
Mhm.
So according to a 2022 NCBI study, 57.6% of physicians surveyed were satisfied with telemedicine services, while 27.8% were not satisfied and 43.7 were neutral.
Yeah.
So some of the reasons why they were satisfied is because it saved them time by reducing travel. It improved their job effectiveness and performance, and it allowed them to accomplish tasks more quickly.
Mhm.
However, the study also found that nearly half of the physicians were concerned that virtual visits could compromise the physician-patient relationship. More than 60% of physicians also reported experiencing technical issues during encounters, and only 29% felt that patients' complaints were adequately addressed.
Mhm. Yeah, so one of the ways that I can see how telemedicine would have greatly improved is maybe during COVID, when people were
Mm,
forced to stay at home,
yeah.
you can really go outside, have other, contact with other people that, may or may not be infected, but just to keep, social distancing protocols maintained. And I see that from a CDC stat says that from 2019 to 2021, telemedicine use increased from 15.4% all the way to 86.5%.
Jesus.
Huge jump. That's a
Yeah.
huge jump, and that's in the years of when COVID was mostly prevalent too.
Yeah, I think, one thing that we needed to really take into play is when these telemedicine had its boom, or like you said, that 15% to 80%. And what years did you say that was, or what time span?
That was, yeah, so 15% in 2019 all the way to 86.5% in 2021. So like exactly the years that COVID was
Yeah.
taking place.
Yeah. 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 I think that boom is something that we need to account for. And maybe because of that boom, this is a very vague field, right? Because it's like, what is telemedicine? Let's break that down first before we start, you know, picking and probing at
Sure.
whatever the pros and cons are. It's I From what I understand, correct me if I'm wrong, it's when a patient and a physician get on a call,
Hmm.
right? Via Zoom, and whatever their injury, whatever they're dealing with, they talk about it and they get assessed via call. No
Hmm.
diagnostic test is taken
Hmm.
as of that moment, and they're able to understand further steps to go forward, and
Hmm.
whether or not to come in person, whether or not to whatever, and what needs to be done to alleviate that. And the doctor can also prescribe medications for them to go pick up
Hmm.
still. Um,
Yeah.
but that's what it is, bare bones, a call. Let's leave it at that. Now, when on a call, when you're talking about the human body, the main thing is that if it's an atypical symptom or something the patient does not know how to explain, that is where it gets difficult, right? Because actually, I take that back, because when you're going in person too, the doctor's going to ask you the same thing.
Yeah.
So there's nothing you can do that's going to change the way the patient responds, actually. If anything, they would say they would be more comfortable online, I think, because
Yeah.
a lot of people are more comfortable in the comfort of their own home. If the doctor asks, is that it? I feel
Mhm.
like if you're in the comfort of your own home, you're going to be more open and you're going to you receive the proper amount of care. But yeah, I don't know. I think there's just a lot of ways to go with this. I'm going to let you structure the discussion because I'm kind of going five different ways here at once. So what
Yeah.
do you want to focus on first?
Yeah, when we look into telemedicine, something I found while doing research for this was also telehealth. So there seems to be a lot of people use these terms interchangeably, but there seems to be a pretty big difference. So
Oh, really?
telehealth uses electronic information and telecommunication to support and promote long distance clinical healthcare. So, it may not. So, when talking about telemedicine, you said it was kind of like a call, correct? Which would be correct.
Right.
Telehealth is more like, having, patient data charts and patient digital images, pictures, videos, or text of what the patient is, going through to help them. While telemedicine is more of that call. And
Oh, okay, okay.
yeah, so that's what seems to be the main difference. And when we were talking about this, kind of took me back to our mental health episode, right? So
Uh-huh.
looking at the ways that you can treat your mental health, if you're talking to like a psychiatrist, I feel like telemedicine would be a great way because you're not exactly taking like your other like physical body measurements or other clinical stuff. You're mainly talking about how you're telling the psychiatrist how you're feeling, what you're going through, and you're just mainly basically having a discussion. So I think that's a great way in which telemedicine can play a part in health, right?
Uh-huh.
Yeah.
Yeah, I agree. I think yeah, I mean, now that I'm really thinking about it and thinking about, okay, like when I go to the doctor, like what kind of questions are asked, like what's really done, outside of asking what's wrong, if you're going in there for a physical checkup, right? Or if, say like you have an injury, it's mainly a discussion-based conversation, like
Mhm.
because it's mainly what the patient is feeling, because like you can't look into somebody's body. I mean, obviously you can. Like, nobody in the comments say, "Oh, there's X-rays, Liamith." What are you saying? Like, obviously there's ways to look into the human body, but what I'm saying is, from a like pre-diagnosis, right? From
Mhm.
nothing, if you don't want to go and expose these people to radiation or whatnot, like the one thing that the doctors are basing off their diagnosis of is the patient talking, is what the patient is saying, right? So like and that's all you can do because like what are you supposed to do? Like you can't like check if somebody's sneezing all the time. Like I'm sure there's like some signs, but you can't like physically without them sneezing in front of you or like say like, "Oh, did you like do you have shortness of breath?" Like
Hmm.
questions like that are just gonna be, the same on telemedicine and in person, where I think honestly, I'm in support of telemedicine from what I can see. I think it's a fine thing, and I think that obviously it's not going to be the same at all. Obviously, that patient physical like in-person interaction, it always still will be there, but I think it's a
Yeah.
great alternative because it again, think about all the time and energy that these physicians are also putting into because I mean, you may not really think of it, and I only recently thought about this, but think about every time you're waiting in the doctor's office, right? You're waiting in your room. The
Hmm.
doctor is not stagnant while you're waiting. The
Yeah.
doctor is in another room talking. As soon as he's done with that room, he or she's done with that room, they leave and go to the other room.
Hmm.
And it's just like a constant walking, walking, talking, walking, talking, opposed to sitting in the comfort of my own home, clicking a join meeting.
Yeah.
Like the difference in that, like
Hmm.
you're telling me in between visits I can go and like pet my dog, like that comfort for even for physician perspective, that's
Hmm.
probably way better for their mental health too.
Yeah.
Going back to our mental health episode, right? And what does good mental health do? Perform better. Perform better, make clear thinking, clear decisions. More energy is going to be able to be put into those patients rather than walking around their office.
Hmm.
You know? So yeah, I honestly like I think I'm in favor of it. I think that this is a great alternative. I think the only issue would be the limited, physical examination. Like you can't physically like bend somebody's wrist a certain ways if it's an orthopedic doctor.
Yeah.
Um, you can't measure their te I mean obviously you can measure their temperature. What am I trying to say? You can't like there's just certain things, right, that you can't do.
Yeah.
And Um, the other thing was, oh yeah, I mean, I don't think this is as a big of an issue, but I was gonna say, the what is it? I literally just had it written down. Oh my God. Yeah, okay, the privacy and security concerns. Some people
Mhm.
aren't comfortable sharing that information via like call because it can like be monitored
Distributed elsewhere,
hacked
monitored.
into. Yeah.
Yeah.
So that's another drawback. But other
Mhm.
than that, I think it's a fine idea. Obviously, there's gonna be like I'm not telling everybody to go like stop going in person, go like join a call online, but I'm saying for those who also like something that we didn't mention that this really big thing. Those who are immunocompromised, those who are at risk for getting contagious, getting clinically acquired infections. I don't know if that's a term. I know there's hospital acquired infections, but like going to the doctor's office, you're at a high likelihood for catching other like diseases, whether it be from the physician, whether it be from somebody in the waiting room. But if
Mhm.
you're behind the comfort of your own home, which is why this was a huge thing when COVID first started, by the way, like in the grand scheme of things, like doing that would be able to alleviate a lot of risk for those who are immunocompromised, which could potentially, lead to time off of work and stuff not. So, yeah.
Mhm. Yeah, and you brought up a great point about like the privacy. I wonder how HIPAA, protocols would play into telemedicine and whatnot. But I also do agree that telemedicine is, a good thing. And even though it might not be as good as actually physically going into your primary care provider's office and getting yourself checked out, it still is a great way for people that, live in underserved areas or people that are from vulnerable populations, right? So I'm thinking some ways that it's helpful is I'm thinking it can improve access to care, first of all, right?
Right.
So geographical barriers. If someone lives way out, far away from like their nearest, major hospital or try to find the specialized care that they need, but they live super far away and, they want to maintain that, that traditional style of life, then telemedicine reduces the need to actually travel and it can make healthcare more accessible for people like that living in remote areas, right?
Yeah.
And I'm also thinking about timely interventions. So if there's something going on and you hop on a call and you got to tell some medical professional ASAP instead of driving all the way down and letting them know, because you never know. Like we were talking about in another previous episode, time is of the essence in medicine.
Yeah.
So you're not always gonna have the time to, get in your car or have someone even, people in your household might be working, gone to school, and you might not always have that person next to you to, drive you to that, office if
Yeah.
you need help. So you
Yeah.
can get timely intervention by just calling someone. And how do you think does telemedicine have any effect on cost? Like, would it be reduced costs or preventative care or
That's a
anything
good
like that?
question. Let me
Yeah.
find that answer. But as you were saying about the rural act and the geographical barriers, something that popped into my mind is um there was a case in Sierra Leone where they had, I mean, this is a low income country, but basically the essence of it is that you can have access to any specialist at any time. If I'm in Georgia and say, God forbid, I'm not gonna say myself as an example. Suppose somebody like they get a condition, right? They deal with, God forbid, someone they have a heart issue,
Mhm.
and there's no cardiologist that's able to figure it out in this local area, then potentially someone from up north in Boston, in California, in Texas, you don't have to go and risk traveling there, and you could still see them, and you could still get a consultation, and I think that opens up a lot of opportunities. And not only if there's not like if nobody knows what's going on, just if there's no like nothing near you. Like again, like obviously there's a lot of doctors in a lot of areas, but just the specialist is the main thing that I'm like thinking about, and like for a specific type of doctor, right? If there's like if you're in Montana and there's a family physician but no orthopedic doctor, like, and it's like a repetitive, like we're talking about like an ACL or a repetitive ligament injury or something like that, like a family physician is only gonna have so much information, right?
Mhm.
So reaching out to that orthopedic physician or surgeon or whomever would be able to give a better, more accurate prognosis and a better plan laid out for them to recover quicker, right? Opposed to the family medicine guy,
Mhm.
uh, would be just the basics of whatever, like rest, recovery, or potentially surgery and whatnot. But yeah,
Yeah, so yeah, those are some great points. And I think one other thing that we can also mention when we look at telehealth versus telemedicine is that in telehealth, it can be used as support for local healthcare providers too. So, continuing education for those that are in training is another way that telehealth is useful as opposed to telemedicine. It's just another difference between the two. So if you have, maybe a student or someone that's new to the healthcare field and they need continued training in that specialty, then telehealth is another way that they can go about with providing the accurate training so that that person can be brought up to standard as well. And there's not too many cons I can think of telemedicine, to be honest. One thing I can do think of is internet access, maybe like if you're from that rural area and you don't have the best quality or the best access to internet, then
right.
that might be a challenge. But other than that, I can also think of digital illiteracy. I'm not saying
Yeah.
as we are in the age now where, a lot of people have access to technology. A lot of people have, adequate knowledge about how to use those technologies. But, there might be some populations that are, again, in those rural areas that are not,
Right. No, that makes sense. Yeah.
yeah, that are not, up to pace with the technology that we have and maybe using some of them and
Yeah.
getting the help that they need. So those are some cons that I can think of.
Yeah, that makes sense. Something, I mean, sorry, I didn't want to just completely stray off from what you said there, but I was looking into the cost side of things, right, again.
Yeah. Yeah.
And something I think we failed to mention was the fact that there is also the insurance aspect of it, right? So there's only some insurance providers currently cover telemedicine. So it varies from region and location, but the cost effective side of things would be traveling there
Mhm.
and spending that time. And yeah, I think I think another thing that we didn't think of is telemedicine could also be used for less critical um cases and less, urgent cases, freeing that space up for the in-person visits who have a more pressing matter than those who are just checking in, like, hey, like I had a small bump on my arm, just making
Yeah.
sure it's nothing or something like that, you know?
Hmm.
So, yeah, I think that's another thing that we didn't think of until now, but yeah, I think this is a huge, huge revolutionary idea. Props to those who created it. Uh, it's been around for a minute now, but I'm glad we finally talked about it on this channel. Do you have any final thoughts on this matter, Jay?
Yeah, so something I wanted to add is now that we also have like, AI and generative AI and things like that
Yeah.
rising, we were just right before recording this, we were looking at some way that they found for AI to, actually take like your vitals. I'm not sure how accurate. I think it was plus or minus 3 to 5 beats per minute,
Yeah, yeah.
your heart rate. So it was a way for them to actually measure your heart rate just through a single camera and just analyzing your face. So AI can also play a huge role in telemedicine. And going back to the cost savings, I found a stat. It said that telemedicine can reduce healthcare costs significantly. And for example, the Veterans Health Administration, the VHA, reported that telemedicine visits saved them approximately $6,500 per patient annually.
Wow.
Yeah, that is drastic.
Wow. That's
Mhm.
a large number. I was not expecting that.
6,500 per patient annually.
Yeah, that's crazy.
Yeah.
Wow. Okay.
Mhm.
So now it's even cost effective. We know that for sure. So
Yeah.
yeah, that's
And
that's that's great.
exactly. And another thing that I found super interesting was how telemedicine came to, be in the first place. So, um, it's not only like during COVID that COVID was when it surged, but before that, it was also there. And, I'm interested in like space and like the Apollo missions. I like doing research on those. And it
Yeah.
seems that NASA actually had its first share a role in the early beginnings of telemedicine because NASA developed early telemedicine technologies in the 60s to monitor the health of
Whoa.
astronauts while they were going to the moon and the Apollo missions, and that's exactly when
That's crazy.
that's insane. Yeah, I never
That's crazy. So it's been around for a minute
been
then. It's
around for
what,
NASA has its
like
role in it.
40, 50 years now. That's
Yeah, like almost
crazy.
60
Oh
years,
no.
like 50, 60. Yeah,
Oh no, wait, more than that. Yeah. I
yeah,
can't do math. Holy, that's insane.
yeah. So
That's
NASA.
crazy. That's kind of cool though. That's kind of
Mhm.
cool. Wow. Do you
Yeah.
know what those technologies were or no?
Yeah, so I've seen like Apollo, like I'm wondering if you've seen like the Apollo 13 movies. Like they have, like they're like the little gauges in like the little lunar module or whatever that they can take to land. But the people in ground control, like Houston and Fort Lauderdale, Cape Canaveral, they always like the mission control they have, or they do like these check-ins with the astronauts saying, okay, your heart rate's looking good and whatnot. So the way that they were able to communicate
Awesome.
in those moon missions and stuff is,
I
and
mean, it makes
having
sense. Yeah.
yeah, it's very essential. If you're traveling in a hostile environment like space, you definitely need to monitor their health. And, it's probably applicable to astronauts right now in the International Space Station as well. So it's a
Mm,
huge frontier.
dang, that's awesome. That's really cool, bro. I'm really glad that you shared that. Wow. Dang, that's it's something to think about. But yeah,
Yeah.
from there to where we are today, like, could
Mhm.
you imagine that leads to treating people during the pandemic?
Yeah. Yeah, there's just
Crazy.
always stuff in especially in healthcare and medicine that, always people working every single day to improve our lives, our state of
Yeah.
living and, our living conditions. And it's something that we should always be appreciative for. And I feel like this video is a great way to,
Yeah.
learn about what they're doing and different technologies that they're coming up with to make sure people have the best care that they need.
Yeah.
So I
Best
had a lot
coverage.
of time, or I had a lot of fun in researching this topic and learning more about it.
Yeah, so did I. I think that was a really cool fact. I'm still kind of
Yeah.
puzzled by that. Not puzzled,
Mhm.
but kind of fascinated by that. But yeah,
Mhm.
I definitely learned a lot. It definitely gave me a chance to, I've known about telemedicine for a while now. Um, but I hadn't really had the chance to sit down and think about it and think about all the pros and cons and think about how it may affect certain individuals. But yeah, I think this was great. I really learned a lot. It was great talking with you, Jay. And yeah, thank you guys for listening once again. Please let us know if you liked this episode more than the last. If you have any suggestions, have any comments, any feedback, let us know. Our Instagram is linked in the description. Please go follow. We will try to start being active on there. Don't know when, but one day.
Yeah.
Um, but yeah, thank you guys. Any closing thoughts, closing remarks, Jay?
Yeah, I had a lot of fun researching this topic, and we hope you guys enjoyed spending the time and learning more about telemedicine with us. And like Liam said, if you have any suggestions on other topics you want us to talk about, just drop them in the comments, and we'll be happy to learn more and share those with you. Thank you.
All right, guys, we'll see you later. Peace.